In this video, we will discuss on hilum of the right and the left lung. Before proceeding further, one should know the basic things about the bronchus divisions. The trachea divides into right and left main bronchus. The right main bronchus first gives rise to the upper lobe bronchus, also called eparterial bronchus, as it lies above the right pulmonary artery. The right main bronchus after the upper lobe bronchus is called bronchus intermedius or the hyparterial bronchus, as it lies below the right pulmonary artery. The bronchus intermedius then divides into the middle and lower lobe bronchus. The left main bronchus is longer than the right side. It is arched over by the left pulmonary artery. In other words, the left main bronchus at the hilum is hyparterial, that is, it is below the left pulmonary artery. The superior pulmonary veins are the anterior-most structure in both the lung hila, and the inferior pulmonary veins are the most inferior structure in the both lung hila. With this basic knowledge, let's draw first the right lung hila. From top to bottom, first is the eparterial or the right upper lobe bronchus, then the right pulmonary artery, then the hyparterial bronchus or the bronchus intermedius, followed by the pulmonary veins, superior and the inferior. This is the superior to inferior arrangement of the right hilar structures. From anterior to posterior, it is arranged as superior pulmonary vein, right pulmonary artery, and the most posterior structure is the bronchus. There is single right bronchial artery which runs along the bronchus. Let's draw the left hilum. From top to bottom, first is the left pulmonary artery as it arches over the left bronchus. Then comes the left bronchus. As it lies below the left pulmonary artery, it is hyparterial in position. The most inferior structure is the left inferior pulmonary vein. From anterior to posterior, left superior pulmonary vein is the most anterior structure, followed by the left pulmonary artery, and the most posterior structure is the left main bronchus. There are two left bronchial arteries that follows the bronchus. Let's draw the mediastinal surface of the lungs and also label its various grooves or impression formed by the mediastinal structures. The right lung mediastinal surface has superior vena cava groove for the arch of azygos, inferior vena cava groove, and the impression of the right atrium. This is the impression formed by the trachea. Posterior to it is the esophageal impression, which continues downward, posterior to the right hilum. Right phrenic nerve passes in front of the hilum, while the vagus nerve passes posterior to the hilum. The left lung mediastinal surface has groove formed by the descending thoracic aorta, arch of aorta, and the left subclavian artery. In the upper part, there is depression formed by the esophagus. The cardiac impression is more prominent in the left lung. Left phrenic nerve passes in front of the hilum, while the vagus nerve passes posterior to the hilum. Let's complete the video here. Hope it was useful. See you soon in the next video.